All right, so we're gonna talk about the DCT.
I'm so tired. My voice.
Yeah. So the distal convoluted tubule is in the renal cortex of the kidney. It has two types of cells. First is the macula densa cells. So the macula densa cells will sense a decrease in blood pressure or a decrease in sodium chloride concentration. So as a result, it will respond by causing vasodilation of the afferent arteriole to increase blood flow, and it will increase hydrostatic pressure at the glomerulus. And in addition, it will cause the granular cells of the juxtaglomerular apparatus to secrete renin, which will lead to increases in blood pressure and blood flow. So now we could talk about the different transporters on the apical and basolateral side of the DCT. We'll talk about the cuboidal epithelial cells of the DCT. So these lack microvilli, unlike the epithelial cells of the proximal convoluted tubule. As a result, they do not absorb as much. So now we could talk about the transporters on the basolateral and apical side. So on the basolateral side, of course, we always have the sodium-potassium ATPase pump, which maintains a Na+ concentration gradient. On the apical side, we have the Na+ Cl- co-transporter that brings in Na+ and Cl- from the lumen of the DCT into the cell, and we also have calcium channels on the apical side that brings in calcium from the lumen. On the apical side, we have the Na+ Ca2+ transporter, which brings in Na+ but brings out calcium.
So that's on the basolateral.
That's on the basolateral side. Finally, we have the effect of aldosterone. So aldosterone is secreted by the adrenal cortex, triggered by release of adrenocorticotropic hormone, which is triggered by release of corticotropic releasing hormone. So the aldosterone will cause activation of the Na+, K+, and Na+, H+ channels, which will cause movement of Na+ into the cell and movement of K+ and H+ outside of the cell.